3 heart medications that are slowly killing men after 70. If you're a man over 70 and taking heart medication, you need to hear this, because what's keeping your heart beating might also be slowly draining your strength, fogging your mind, even robbing you of your independence. I followed every rule, took my heart pills on time every day for years. And then one morning, I blacked out. No heart attack, no stroke, just collapsed in my backyard with no warning. Later, I learned something that shook me. The problem wasn't my heart. It was the medication I trusted to protect it. What's worse, I'm not alone. Thousands of older men across the U.S. are experiencing side effects that mimic aging weakness, confusion, fatigue. But in many cases, it's not age at all. It's how these drugs interact with our aging bodies. After 70, your organs change. Your liver slows down, your kidneys filter less. But most prescriptions don't change with you. And that mismatch, it can be dangerous. In this video, I'll show you the 3 most common heart medications that may be silently harming men over 70, and how to talk to your doctor before it's too late. If you find this helpful, hit subscribe. It helps this channel reach more people who need this information. Now tell me honestly, which would you rather have? A healthy heart on paper, but no energy or clarity. B, a slightly imperfect heart, but a strong, independent life. Comment A or B below. I raid everyone. Coming up, the first medication that could be weakening your body without you knowing. Statins are among the most prescribed medications for older adults. If you've ever been told you have high cholesterol chances, or you were handed a bottle of Lipitor Crestor or Zocor and told to take it for the rest of your life. But here's what most men over 70 aren't told as we age. Statins don't work the same way in our bodies. And in some cases, they may cause more harm than good. Many men begin to notice subtle changes. You might feel more tired in the mornings. Your legs may ache when climbing stairs. You may forget where you left your keys more often. You chalk it up to aging, but the culprit could be your cholesterol medication. That's because statins are known to cause muscle pain, fatigue, and even mild cognitive decline in older adults. According to the Mayo Clinic and Harvard Health, these side effects become more common after 70, when the body processes medication more slowly and loses muscle mass naturally. The danger isn't just discomfort. Prolonged muscle loss can lead to frailty falls and a serious decline in mobility. For some, it becomes the tipping point that leads from independence to dependence. The real tragedy is that many men continue high-dose statins even when their cholesterol is already under control. No one reevaluates the dosage. No one asks if the risks now outweigh the benefits. But you can, and you should. Start by reviewing your latest blood work. If your LDL is below 100 ml and you've had no recent cardiac events, it may be worth discussing with your doctor whether a lower dose or even a pause is appropriate. And if you're taking statins and experiencing fatigue or unexplained pain, ask about supplementing with CoQ10. Some studies show it may help reduce statin-related muscle symptoms. You're not powerless. Medication should help you live better, not just live longer. And sometimes the most important step isn't adding more pills. It's asking the right questions about the ones you already take. Because the goal isn't just a healthy lab result. It's to wake up each morning with energy, clarity, and the strength to keep living life on your own terms. And yet, A clean lab report isn't enough if your feet can't stay steady when you stand. That brings us to another common heart medication, one that's meant to stabilize you, but might actually be throwing your balance off completely. Beta blockers like metoprolol and atenolol are often prescribed to manage high blood pressure or irregular heartbeat. They work by slowing down the heart rate and reducing how hard the heart has to pump. For younger patients or those recovering from a heart attack, they can be life-saving. But for older adults, especially men over 70, the same effect that makes them helpful can also become dangerous. If your heart beats too slowly, it doesn't pump enough blood to your brain and muscles. That means you might feel dizzy when you stand up. You might feel constantly tired, cold, or even mentally foggy. These aren't just minor annoyances. They're early signs your body isn't getting the oxygen it needs. What makes this even more concerning is the increased risk of orthostatic hypotension, a sudden drop in blood pressure when you stand. That one issue alone is responsible for thousands of falls and ER visits among seniors each year. And yet, beta blockers are rarely adjusted for age. Your dose at 75 may be identical to what you were given at 60, even though your metabolism, kidney function, and nervous system have changed dramatically. I learned this the hard way. One day, I stood up too quickly and nearly blacked out. I was lucky, just a bruised arm and a shaken confidence. But that moment made me ask, are we checking the right numbers? It turns out, we often focus only on resting blood pressure. But what matters just as much is your standing pressure. What happens when your body shifts and adapts? If you're on a beta blocker and feel lightheaded or unusually sluggish, ask your doctor to check your blood pressure, both sitting and standing. It could reveal a problem that's been hiding in plain sight. Medication should stabilize you, not steal your balance or clarity. And if your treatment plan hasn't changed in years, now might be the time to review it. You deserve more than just numbers in range. You deserve a life where you feel steady, strong, and fully present in every step you take. We've talked about medications that drain your strength and slow your heart. But now let's talk about the one that might be quietly draining something even more vital: your fluids, your minerals, and over time, your clarity of mind. Diuretics, also known as water pills, are commonly prescribed to lower blood pressure or reduce swelling. They include drugs like furosemide, hydrochlorothiazide, and bumetanide. On paper, they look harmless. They flush out excess fluid, relieve the strain on your heart, and make you feel lighter. But after 70, that lightness may come at a heavy price. As we age, our sense of thirst becomes less reliable. Our kidneys lose efficiency. We're more prone to electrolyte imbalances, especially low sodium and potassium. Diuretics by design flush both water and essential minerals out of the body. And when that balance is thrown off, the consequences are subtle at first. You might feel a little lightheaded when standing. You may get cramps in your legs at night. You forget a name here and there. It seems like ordinary aging. But when dehydration and low sodium build up quietly over time, they can lead to mental confusion, severe fatigue, and in the worst cases, dangerous falls or even hospitalization. And here's the part that often gets missed. Most men don't connect these symptoms with the little white pill they've taken for years. They just assume they're slowing down when really they're drying out. I started asking questions when I noticed I needed more naps, and couldn't finish a simple walk without feeling foggy. Lab tests later showed mild hyponatremia, low sodium, likely caused by years of daily diuretics and not drinking enough water. If you're taking a diuretic, ask your doctor to check your sodium, potassium, and kidney function regularly. Blood pressure is important, but so is what those medications are doing behind the scenes. Don't wait until you faint or fall to find out something's wrong. You can also support your body by staying hydrated, not just with coffee or tea, but with actual water. Aim for 6 to 8 cups a day, unless your doctor advises otherwise. And if you've been on a water pill for years, it's worth asking whether the dose still fits your body's current needs. Because medications are meant to protect you, not quietly pull the life out of you, drop by drop. Sometimes the solution isn't another drug. It's restoring the balance your body has been quietly begging for. The older I get, the more I realize this truth. Good health isn't just about what you take. It's about what you question. Most of us grew up trusting doctors' prescriptions and protocols. We followed the instructions, did what we were told, and hoped that would be enough. But after a certain age, that kind of blind trust can become a dangerous habit. Because your body at 75 is not the same body you had at 60. It doesn't break down medications the same way. It doesn't absorb, filter, or respond with the same resilience. And yet most treatment plans stay exactly the same. That mismatch between an aging body and a fixed prescription is what quietly steals the energy, clarity, and independence so many men are losing in their later years. But here's the part that gives me hope. We're not stuck. We're not powerless. We can ask better questions. We can demand better conversations. Not in fear, but with wisdom. You don't need to become your own doctor, but you do need to become your own advocate. That means reviewing your medications at least once a year, asking whether the dose still fits your age, your lab results, your goals, tracking side effects even if they seem small, trusting what your body is telling you, not just what the label says. And most importantly, remembering that health after 70 isn't just about numbers. It's about how you feel when you wake up, how steady you stand, how clearly you think, how much life you have left in your living. There is a version of aging that doesn't involve giving up your energy or your mind. But to get there, you have to stop assuming everything you're taking is helping. Sometimes the strongest step you can take is to pause, rethink, reclaim your place in the conversation about your own care. Because the goal isn't just to add years to your life. It's to add life to the years you still have. If there's one lesson I hope you take away from this video, it's this: your health is not a passive journey. You're not just a patient. You're a participant. Aging isn't about giving up control. It's about learning to listen differently, not just to your doctors, but to your own body. That subtle fatigue, that occasional dizziness, that brain fog you've brushed off, those are signals. Your body is speaking, and you deserve to be heard. So start small. Set a reminder to review your medications every 6 months. Keep a notebook of how you feel day to day. Bring your questions to every doctor, visit even the uncomfortable ones, and never let anyone dismiss your concerns with, "That's just what happens when you get older." Because you still have choices, you still have a voice, and the decisions you make today, even small ones, can shape how clearly, how strongly, and how independently you live tomorrow. Now, I'd love to hear from you. What's one thing you've learned about your own body after turning 70 that you wish someone had told you sooner? Share it in the comments. You never know who you might help by speaking up. And if this video helped you think differently about your health, I hope you'll subscribe. Not just for more content, but to be part of a growing community of people who believe that aging should be thoughtful, informed, and empowered. If you feel moved to support this work, you're welcome to leave a small donation. But your presence, your engagement, and your voice already mean the world. Thank you for being here truly.